It is Tamara. I am back with another video. This is going to be our final video of the week, talking about multiple personality disorder or dissociative identity disorder as it's currently known as. We're going to talk a little bit today about treatment options and some of the treatments available. So thank you so much, guys, for those of you who have been subscribed to my channel, and for those of you who have been participating this week. I've enjoyed all of your questions, all of your challenging thoughts, and your own experiences. I've gotten so many emails this week and so many comments on my YouTube here that, you know, I have designed at least 2 to 3 new topics out of it. So thank you so much for doing that. For those of you who are not subscribed, I encourage you to go ahead and hit the subscribe button over here. Then that way you can stick around with us as we talk about new topics. On Monday, we're going to start talking about the counseling relationship, and I want to talk about some reasons why counseling is so difficult. And I also want to add a video that talks a lot about some of the things that you can do to sabotage your own therapy. So we're going to talk about that on Monday. But let's go ahead and get started today. The benefits for you in this video is that you're going to learn a little bit about some treatment options that are available for dissociative identity disorder. All right, so let's just go ahead and jump in. So when you're thinking of dissociative identity disorder and the treatment and everything that we talked about Monday, Tuesday, Wednesday, Thursday, right? So everything that we talked about this week, when you think of that, I'm sure you're wondering what kind of treatment options are available. Well, I mentioned yesterday in my video, I'm going to post it up here in case you missed that. I mentioned demonology and exorcisms and pastors and demonologists who utilize Christianity or utilize their faith in their religion to exorcise an individual. The whole idea behind that concept, or the whole idea behind the field of demonology, is that we have a spiritual realm. I'm a firm believer that we have a physical realm and we have a spiritual realm. There are things going on that's spiritual. Everything isn't always what we see. So those kind of individuals work in the field mostly of demonology, and their whole point is to study the spiritual world, the metaphysical world, right? The world that we don't see, the world that we don't feel most of the time, right? It's an abstract concept to us that there's a spiritual world. Well, demonologists utilize their knowledge of spiritual things. They utilize their knowledge of scripture. They utilize their faith in God to help them treat an individual who they believe is possessed or embodying another entity or spirit that has taken them over, has gotten in the way of their ability to think and function and behave in daily life. So that's the perspective of demonologists. But what do psychotherapists do, right? What do they do to rectify the individual who believes that they have multiple personalities or fragmented pieces of themselves? Well, the first line of treatment is something known as cognitive behavior therapy, CBT, cognitive behavior therapy. The whole idea behind CBT is that you're going to go to counseling to rectify how you see yourself in the world. Not only yourself, but how you see all your other personalities in the world, right? The whole idea of multiple personality disorder is that there's fragmented bits and pieces of yourself. So the treatment approach, I guess I should say, is that we want to integrate those personalities, right? We want to unify them, because there are cases where individuals feel that the other parts of their personality, right, the fragmented pieces, go against them. All right. I think I mentioned this yesterday or the day before yesterday in one of my videos, that I had 2 clients who were males, and they were a close case to multiple personality disorder, right? They showed all the symptoms, they had all the behaviors, they were just too young for the diagnosis, and the diagnosis didn't quite fit, but they were very, very close. Well, those 2 individuals that I had talked about, they were being treated for dissociation, right? Not DID, not multiple personality disorder, but they were being treated for dissociation. In order for them to feel better, they had to unify their own personality and their mind and their interests and their strengths and weaknesses with those other people that they claimed were inside of them. Now, cognitive behavior therapy focused on unifying the destructive parts of one adolescent basically had one personality, which was the rescuer, and he had another personality, which was basically the persecutor. I'll put it that way. And when the rescuer would try to do things, the persecuting personality would go against the rescuer. And then the persecuting personality would self-harm, right? It would cut this kid. It would strangle this kid. It would pull this kid's hair out. It would even snatch out eyelashes. And he had no idea that this piece of himself, right, this fragmented piece, let me shut my laptop, guys, the battery's low. This fragmented piece of himself was actually fighting against him, and he had no idea that this was happening. He would actually go into a trance-like state. He would have a seizure, and then he would kind of have convulsions, right? He would have this whole full body physiological experience, and then he would start self-inflicting harm, all right? And so he said that the one personality, who was named Robert, was actually inflicting harm on him, okay? So in order to prevent that, therapists seek to integrate personalities, and they utilize the tools often representative of cognitive behavior therapy. The whole idea of CBT is that we want to work with your thoughts. We want to change the way that you perceive things. We want to turn the way that you see reality. We don't want to make it positive per se, but we want to make it as balanced as we can. Some CBT therapists are also specialized in trauma. So I don't know if you've heard of this, trauma-focused CBT. That's trauma-focused hyphen cognitive behavior therapy. I'm going to put a website down in the description box for you. I've been doing this all week, so forgive me for being haphazard, but down in the description box, I'm going to put a link for you so you can learn a little bit more about trauma-focused CBT. But the whole idea behind that is that we utilize CBT, but we do it with a trauma informed mindset. Now, I am internationally certified as a trauma therapist, and I work a lot with individuals who are struggling with psychological and emotional trauma. One of the things that I like to do is timelines. If the individual is healthy enough and they are ready, they look like they can benefit from treatment, I really do like to target that timeline, because if we can go all the way back to the time when you remember, we can work our way up to your current age, and we can look at what are some of the things during that timeline that may be influencing how you see yourself, those fragmented pieces of yourself, and how you see your life with these so-called multiple personalities, okay? So CBT, family therapy. I absolutely think that a treatment plan with a therapist should always include family therapy, especially when you're working with multiple personality disorder or DID, and especially when you're working with youths. I am a child and adolescent therapist. I work with a lot of families. And so because of that, family therapy is the number one thing that I have to include in most of my treatment, right? Families need to be educated. Parents need to know what's going on. Extended family members need to know what's going on. Grandparents need to be aware and on board, right? Parenting tools and skills need to be fixed and adjusted. So family therapy, all right? The next one is medication, all right? You cannot medicate multiple personality disorder or DID, but you most certainly can medicate the symptoms around that multiple personality disorder. So for example, if let's say you have DID, all right, multiple personality disorder, dissociative identity disorder, let's say you have that, and you come to see me 2 times a week for 90 days. And we are trying to right now reduce your depression. We're trying to reduce your anxiety. We're trying to build coping skills, right? All of those things can be targeted with medication. The less depression, the less anxiety, the less frustration, the less aggravation, the better therapy is going to be for you. In order for you to benefit from therapy, you definitely have to have medication sometimes. Sometimes depression is clouding your focus. Sometimes anxiety is boiling under the surface, and you need those things to stop so that you can redirect your attention and focus it on what you need to focus on in therapy. All right, so that's all medication would do. Medication is not going to get rid of the multiple personalities. It's just going to help you get rid of the other symptoms that are in the way. Think of it like this. It's kind of like surgery, right? You can't take a medication to get rid of a tumor, but you can take the medication after the surgery to get rid of the pain of having the tumor removed. Does that make sense? So surgery, right? It's kind of like that. You have a tumor, but the medication can't get rid of the tumor. The medication can soothe the pain that you're going to feel after the surgery. All right, that's the way I want you to see this. All right, so the whole idea of counseling and psychotherapy and psychiatry with people who have dissociative identity disorder or multiple personalities is to integrate functioning. We don't want you to have one personality self-harming, another personality causing you to convulse, another personality causing you to shut down and be angry all the time. We want an integration so that you can create a full self that's functional and healthy. That's the goal. Right, that's the goal with DID. Now, I found something which is something that I had in my records, and it was from the Journal of Trauma and Dissociation. I will post that article in the description box for you, and it talks about the different treatment approaches. Hey guys, so sorry for that. I had to fix my camera, switch my camera, my battery went out. But I will post the article in the description box below for the Journal of Trauma and Dissociation. They name 3 things that they seek to do, or psychologists seek to do in the treatment of those with dissociative identity. So here's the first one. The first one is fusion and integration, right? We want to fuse and integrate those personalities. The other one is a unified perspective. They want to make sure that we can unify the perspective between all the different personalities. And the third thing was a focus on trauma. They wanted to make sure that there was integration or fusion of the personalities, that there's a unified perspective within the person, and that trauma-focused therapy is also integrated. Those 3 methods is basically the evidence-based treatment approach for multiple personality or DID in today's society. All right? We are going to stop this conversation and we're going to start all over next week. Thank you so much for being with me today. I encourage you to give this video a thumbs up if it was helpful to you. Let me know what you're thinking about this topic. I've mentioned a lot of controversial things all this week about this topic, so throw it at me, guys. I want to hear what you have to say. I think that creates a learning environment, right? And an objective learning environment, because then when you ask a question or you say something, then I can feed you back, and then somebody else will feed. And so I think it's a good community. I'm very proud of you guys for your participation and all your questions to my email box. Thank you for that. I encourage you to hit the subscribe button if you want to stick around with us and help build the community. We are growing hourly, and I think it's so awesome. So thank you so much for your support and for your participation once again. All right, I will see you Monday. Have a great weekend. You deserve it. Bye-bye.